every activity, particularly in India and in yoga tradition, with the blowing of the conch shells. And this is a very special art. It's also a yogic breathing. You will see how hard it is to blow them. So Dr. Abha Gupta and Meeta Chakrabarti, they are going to blow the conch to start our yoga session. Go ahead. The fifth yoga therapy session. Thanks a lot. That was wonderful. Hey, they just did a great job. Actually, one of the breathing techniques that Dr. Sarkar might show you how to do it without a shell. You can do it with your fists. Anyway, with that introduction, and Dr. Chakrabarti, you and Dr. Sarkar both are medical doctors who have transformed, slowly changed the thing back from their study. At least Dr. Sarkar has completely given up his practice after his heart attack. But he is now the yoga therapist and Ayurveda practitioner. So with that brief introduction, so Dilip.
Okay, thank you. So let me turn him off so we can start now. Can you come to the front? Actually, what we do, thank you. I mean, this is the 5th year, and we like to do practice for the whole day. And people love it because we do it so slowly and gently. But the problem here is we need to eat probably sometime. So when we eat, we like not to do any practice after eating. So we'll be practicing from now until the lunchtime. And take a little lunch break, we'll have a little question and answer, and we have the whole program here. And after lunch break, we'll do a little bit of a discourse, and then at the end, we'll have a whole session of pranayama and meditation before we finish. Now this is entirely different than what yoga practices, This is all about yoga as a therapy. Here we have people who comes in a wheelchair. People comes, with a total knee replacement. People with a 300, 400 pounders with hypertensive, diabetics. So the basic concept here is we want you to pick it up from here. How to introduce a practice of yoga, a person with a chronic ailment. This is number one. Number two, you will see that when they keep on practicing that yoga, there is a transformation takes place. That's what yoga is called, the art of transformation. And the transformation is very obvious. Even if it is not obvious from outside, it is obvious within you. You will feel the transformation within yourself. It will come to the point of transformation that you will really become a normal, healthy person, overcome all the disease. That's the time you'll do a daily practice of yoga. When you do daily practice of yoga, essentially maintain your health so the disease will come back to you. So this is the concept. That you have a disease, will overcome or cure the disease, will maintain a health. But what you need, we have a lot of examples here sitting, and only bottom line here is if you ask the person, what is your secret to be healthy and overcoming the disease? There's only one answer, is a daily practice. Yoga, like a Western practice, does not tell you to do twice a week, 3 times a week. Yoga is 24/7, all the time, and it will tell you how to incorporate yoga 24/7. You have the whole handout, you have the whole, all the slides are with you. We have given it to you for a few things. First, for you to practice with this, or to keep you as to use it for your teaching tool, you know, if you're a teacher, and also it's like an archives, you know. You have these archives, you can use it for your future practice. So the first, you have all the agenda here, and you saw that we'll be doing a practice session from the whole morning. We'll take a little lunch break, and then we'll go for anatomy of the asanas. There's a story of personal transformation, and this is the most important thing that you need to know. A lot of people ask, what kind of yoga do you do? There is no kind of yoga. This is the yoga from the scripture. This is the yoga called the philosophy and the practice. Philosophy is called Yoga Sutra of Patanjali, 196 sutras, and if you see, all the sutras are really based on controlling your mind. Then practice is the 8 limbs of yoga. Then we'll show you some esoteric practices, mudras, bandhas, kriyas. We'll let you overcome some of your fear, difficulties. We'll show you how to do a little neti part so that you can do it every single day before yoga practice. At the end, we'll do a pranayama and meditation. The first we are going to talk about it is that what is in yoga therapy? Most of the yoga teachers ask me, if I do a practice of yoga, it becomes a therapy. So what does the yoga therapy mean? Yoga therapy basically means it's an adaptation of the yoga practice for the people with chronic ailment. I have a total knee replacement. I need to sit down in a chair. I cannot sit down in the floor, or I cannot sit down in the floor. I need to start sitting in a chair. Or we have a one person in our morning class. She cannot even sit down. It's a back pain. She does her, the pranayama practice laying down in the mat. She brings a little thick mat. She's laying down and she's doing it. So this is a very important concept of yoga therapy, adaptation. And then what it does, it is the art of self-transformation. This is a very interesting and important concept that you have to take home. Something will happen to you, and interesting is that changes you will feel within yourself. You will have no language to speak, you have no language to write, but it is all within feeling yourself. And that is basically is your self-realization. You realize, and after yoga practice, we come to a point, what you call, I am the cause and I am the cure. You will exactly figure it out, what caused your ailment and what is going to overcome your ailment. And finally, it is the art of self-healing. These are Sanskrit words, very, very commonly used. Person who has a disease in Sanskrit is called a ROGI. And with the practice of gentle pranayamas and gentle asanas, meditation, they transform into people with no disease, called NIROGI. This is the transformation. And finally, they convert into yogi or yogini, and that's the time what you know what yoga practice is. And this is the famous quote by a person called Desikachar. Desikachar is one of our prime yoga teachers from India. He comes from Chennai. He says, in stages, impossible become possible. If you go to Yogaville, you will see in Yogaville. Any of you been to Yogaville? Good. In Yogaville, you'll see at the entrance, it says from Swami Satchitananda. That was different. It said, with faith, impossible become possible. So, What is more important about yoga therapy is what Hippocrates said before. It is more important to know what sort of person has a disease than to know what sort of disease a person has. You know, yoga therapy is not interested about the disease a person has, they're interested about the person who has the disease. We want to transform yourself. We are not going to go after diabetes, we're not going to after hypertension or heart disease. We are going to after a relaxation response with the control of your mind controlling your body. We're going to control your 5 senses, called pratyahara. You know, the 8 limbs. Once you do the 8 limbs, so this is very important concept. But essentially we'll come down at the end. We come it called a reductionist model. This is called a holistic model. Holistic model means we want to transform you as a person. Reductionist approach is, I have diabetes, what should I do? We'll give you at the end, but we don't want you to do it at the beginning. At the beginning, you create the relaxation response, so you'll be able to come to the point. So this is the way when there is a person with a disease comes to us, we go to 2 things. We call the Merudanda Achal and Manasthir, then you go for the relaxation response. Let's go ahead and start as if we are having somebody came in with a disease, and we are going to start now. The first, as I said, you are going to be sitting down with the spine straight. So any way you sit down, you keep your spine straight. You can sit down in a chair. If you sit down in a chair, you sit down in a chair, go all the way to the back, keep your spine straight, shoulder to the back. And the concept here is, my skeleton is being always kept up. I'm straight because contraction of the muscles of my side of my spine, or paraspinal muscles. If I give a little bit of rest to these muscles, the relaxation response sets in. Then it comes to your point of the components, we bring it as a relaxation response. Before you get into the asanas, the first and foremost asana you need to get in as a person with a disease is called Sthiram Sukham Asana. Sthir means I'm still. In an asana, most important concept here is, it is called the internal balance, the internal stillness. I'm able to sit down. If I give a little bit of imbalance, I start developing a little bit of muscle fasciculation. It's called twitching. That is an imbalance. I be able to sit down, then I'm able to sit down. Sukhi means I'm happy. I'll be able to sit down. Do not force yourself. Even if you're sitting here, sit down here. 2 components you to look for is for pain. If you come down here, if you feel pain, back off. But you stay. And then with the relaxation response, it will come to you instead of you are looking after that. And second is your breath. Your breath has to be completely effortless. So your awareness as a person with a disease will be no pain and able to breathe effortlessly. You will see, we'll be going slowly and slowly in deeper and deeper poses, which you will be able to practice with us, or you will be able to sit down and relax and watch we are doing. So after the spine straight, we bring the mudras called your Dhanu mudra. You touch your index finger and thumb, you put gently over your knees. So what the mudras does, the mudras literally controls your mind. You will see in the presentation of the anatomy, you will see a little men. The picture Dr. Chakraborty will show you. Our motor cortex, the brain, if you compare the area of the brain controlling our hands, is almost the half of our body. Half of the brain controls our hands. When I'm talking, I'm moving my hands before my tongue. By closing my hands, I quiet down my mind. This is very primarily compliment. Then what we'll do, we close our eyes. If you keep your eyes closed, you bring the calmness and quietness. All the five senses keeps us awake, alert, and oriented. The vision is the most powerful of five senses, part of pratyahara. Close my eyes, keep my spine straight. I then touch my index finger and thumb. Now I pay attention to my breath. My breath will be now, is that lung is like a balloon. I need to empty the lung. We'll be breathing out longer than breathing in. And breathing out, exhalation is parasympathetic. Breathing in is sympathetic. So let's practice at least about 2-3 times and you progress. First, you will breathe in with a count of 2 in, like 1 and 2 in, and count of 4 out. We'll do it twice, then we'll breathe progressive with a count of 3 in, count of 6 out, count of 4 in, count of 8 out. Let's first start, count of 2 in, count of 4 out. One more time, count of 2 in, count of 4 out. Now say count of 3 in and count of 6 out. If you can do count of 3 in and count of 6 out. And count of 6 out. Count of 3 in. Count of 6 out. If you can progress a little bit more, you can do count of 4 in, count of 8 out. One more time, count of 4 in, count of 8 out. If you keep on doing it, you will develop some relaxation in your physical body. When the physical body relaxes, you can progress. You can progress to the next asana, it's called Siddhasana. You can take your heel all the way to the back. You can take your one foot on the top, and you'll see your knees just drops down. When relaxation sets in, you don't push yourself. It'll come to you. This is called a Siddhasana. If you cannot do it today, don't push yourself. You stay where you're comfortable. From the Siddhasana, you go back to calm. Ardha Padmasana or Swastika Asana. Again, keep it here, slowly and slowly it will come down on its own. Instead of you pushing for it, let it come to you. And finally, the yogic asana, which all the yogis want to sit down, is a Padmasana or a lotus pose. In a lotus pose, Catherine, he's there in the office, if he may have to slow down. It's okay now, but in a lotus pose, your knees, hips, backs, all are completely fixed and relaxed. Most of your pain goes away, and able to sit down, most of your disease will go away. But with a person with a disease, they're able to come in here, probably not. But essentially, you will be able to come here. From here, we create a vibration. You saw that, you did the morning, they did the blow the conch shell. We create a vibration called a sound of Om. Yoga gave the sound of Om. Om has the same frequency as the frequency of your brain. Two frequencies interfere, we call it harmonic resonance, it cancels. So in yogic Om, what you do, you will breathe out first, then take a deep breath in, and we'll bring out the sound of Om, A, U, Ma, from the lower part of the lung, middle part of the lung, upper part of the lung, and will continue as long as you can to increase the exhalation. Let's start, we'll do it 3 times. First, breathe out first. Take a deep breath in. Open your eyes, rub your hands together. Very good yogic gesture. Once you feel it is nice and warm to your hands, you feel the heat, and you put it over your eyes, cup your hands over the eyes, massage your forehead, massage your eyes, massage your face and head and neck. It's a very good yogic relaxation. It improves your vision. It has been shown in clinical practice that if the eyes muscles get relaxed, the vision improves because it increases the diameter of the lens. It reattaches your diameter of the globe. The globe is very softer. It has been known even when a muscle relaxant is given to a patient, before they will intubate, the patient will say, I see better. So it is a very powerful relaxation. So this is the one we like a person with a disease to able to ground themselves, able to sit down, and able to go back and do this pranayama practice. Very important is that if you look at this pranayama practice, which we'll be doing this afternoon, and these are the effortless pranayama. Most important thing about pranayama, the pranayama should be done with a method, and we'll teach you the method. There's a timing with the timing. There is a design. It is like a prescription for the pranayama. You do between 5 to 10 minutes, and you do completely effortlessly. You make no effort. It will come to you. Initially, it will do 30 seconds. Then you will do a called sankalpa, determination. Siddhi is attainment. First to the Bastrika, then Kapalbhati, Anulom Vilom Pranayam, and Bhramri Pranayam, Sitali and Sitkari Pranayam, Shankha Pranayam, Om Pranayam. We'll go over with this afternoon, and then when you became a little bit more proficient in that, when you become like a NIROGI, we'll include more and more pranayama, especially with the called your holding, breath holding called kumbhaka. So from here, then we do a little meditation. We'll do two meditations. One is called empty bowl meditation, and another is called chakra awakening meditation. We'll do this evening, and then we come to a point here when a person starts doing a little bit of relaxation. The relaxation will start first with the relaxation of the smaller joints. So sitting down, first we start with the relaxation of the hand. First is called Adhi Mudra. You do your hands, both of your hands, yogic fist. In yogic fist, you put a thumb inside and close. You do not fist like that. You put your thumb inside and close and do the Adhi Mudra. You do with your breathing. You can put your hands in front. You breathe in and breathe out, close with the fist. Breathe in, open your hand, breathe out, close your fist. If you do it a few times, your hands will start to relax. And do it 24/7. All the time you're doing it, relaxing your hand, called yogic fist. Also, you can even do with your breathing and pull it towards you. You can do it like sitting down, breathe in, breathe out, pull towards you, breathe out. You can do your hand, put it together, relax a little bit. Relax, bend forward, bend backwards. It's all in relaxation of your hand. Then you'll come with the wrist. You put your wrist high up, breathe in, and breathe out, drop it down. Breathe in, breathe out. Breathe in, breathe out. Also what you can do, you can put your hand in the front for the wrist. Your hands will be like this initially. If you keep on breathing, count of 3 and count of 6 out, slowly and slowly you will see your hand goes down, your hands will be like here. When hand becomes like here, which will happen to you someday, not today, all of your wrist pain, wrist relaxation will set in. Carpal tunnel pain will be gone, all the pains will be gone. See, my hand is laying down, I'm talking, I'm breathing, I'm completely effortless. It's very important. So, hand and the wrist. Then it will come to your elbow joints. When it comes to your elbows, what you will be doing is your Paschim Namaskar. Paschim Namaskar is that you put your hands into the back. Take a prayer pose and slowly you turn it here. Slowly we'll go high up and go way high up here. When you'll be able to sit down like this, you will feel the effect of relaxation in your elbows. The small joints are going to relax one at a time. Able to stay in the pose is very important. Wherever you are, doesn't really make difference, but you are able to put your hands together. What it does, first, muscle contracts. Able to stay here completely effortlessly. I'm talking, I'm breathing effortlessly. It will slowly and slowly muscle will start to relax. Essentially, muscle will come to the point of relaxation that it will give you a profound sense of relaxation. It is called your Visharjan. Very important. Then come back for the shoulder. We call it a Skandha Chalanasana, shoulder movement. So put your hands in nose, sometimes put it on the knee comfortably. You breathe in and just rotate your shoulder. Just think about as if there is a pencil in your shoulder and you are making a big circle, but do with your breathing. Breathe in the middle, breathe out, make a big circle. At home, if you do it, you can do it 5 times on each side. You breathe in and breathe out. Then you breathe in, all the way to the back. 5 times, so breathe in, go to the back. And the name of this is called a shoulder moving asana, or in Sanskrit is called a skandha chalan asana. Also, you can put your hands on the shoulder, elbows together, breathe in, breathe out, make a big circle. Breathe in, then breathe out. With your breathing, learn how to do a very effortless breathing, so it will come to you. To the opposite side. Breathe in, completely go to the opposite side. So you're slowly preparing your body for the asanas. Hold your hand on the top, you breathe in. Breathe out, pull your head down behind your head, and the same breathing cycle, bring it to the top. Breathe in the middle, breathe out, all the way down, and bring it to the top. Again, do it about 5 times, and with the daily practice, it will bring a tremendous relaxation to your shoulder joint. People with a rotator cuff tear, frozen shoulder, they will get better with this. Then it comes to the neck. It's called Brahma Mudra. Brahma is the name of the Supreme Being. Mudra is a gesture. Sit down again with the cross-legged. Touch your index finger and thumb. Breathe in, drop your neck all the way to the back. And breathe out, just put your head all the way to the front. Put your head all the way to the back, so breathe in, and then breathe out in the front. No pain and effortless breathing. If you bring your head down, you feel like you have a little bit of effort, back off. Breathe in, breathe out. Do it about 5 times at home. This is the first one for the Brahma Mudra. Next one, you breathe in the middle, drop your head on one side, and the same breathing cycle, bring it to the middle. Breathe in the middle, drop on one side, and same cycle, bring it to the middle. Again, have your eyes closed and do it your own breathing, so you'll progress. Breathe in and breathe out. Breathe in the middle, breathe out all the way to one side, and bring it up in the middle. Third one is breathe in the middle, look all the way to the back without turning your shoulder. Again with your breathing, breathe in the middle, breathe out all the way to the back without turning your shoulder. And bring it again in the middle. Have your eyes closed. You don't know who is doing what. You are doing with your breathing. Breathe in the middle, breathe out all the way to the back as if you're trying to see the middle of the back, and bring it back in the middle. This way also you extend your exhalation. Breathe in the middle, look all the way to the back without interrupting your breath. Finally, you will rotate your head like a dog. Breathe in the middle, drop your head down, breathe in, turn to the left side, then to the back, then to the right, then to the front. Breathe in the middle, just rotate on your left, to your back, to your right, and in the front. Do it with your breathing. Most important thing is that, as I said, you are doing the self-healing yourself. This will create a little bit an altered sense of consciousness. So please do not do it standing up. Always do it sitting down. You can do it 5 times on each side. You can also do on the other side. Breathe in, start from the other side. So right side, go to the back, go to the left, the front. You go for the lower jaw, lower body now. You extend your legs in front. Sit down. It's called a dandasana. In a dandasana, you put your hands on the side and just start with the toes. Separate your toes. Bend your toes with the breathe in, breathe out. Close your toes like a fist. Padamustikasan. Breathe in, breathe out. My eyes are closed. I have no idea who else is doing what. I'm paying attention to myself. In fact, when eyes are closed, you get into, slowly and slowly, you get into the state of called your sapna or dream state, and you start visualizing your subtle body. Ankle joint, breathe in and breathe out. You have to do an ankle joint, breathe in and breathe out. Flexibility of the ankle joint is very important. You can rotate your ankle joint. Flexibility of your ankle joint gives you your physical independence. No rush with your breathing. Breathe in the middle. Slowly turn your feet around. Separation of toes are so important that the market is full of it. Yoga shoes, yoga socks, yoga toes, you name it. It is all based on separation of the toes and supporting your arch. For the knees and the hips, you take your foot on the top. It is the hip moving and knee moving asana. Take your hand, my hand goes in between the toes. They go very easily. When you relax, the finger goes in and out. When you're very tight, you're very tight. The tightness will go away slowly. You hold on to your knees, you breathe in, breathe out, slowly it goes down on its own. You don't have to push it down. If you push it down, it recoils back. It'll go down on its own. Breathe in, breathe out. Breathe in, breathe in, breathe out. Do balance on both sides, take the other sides. So you're preparing your back. Put your fingers again in between the toes. I'm putting my hands here. I breathe in, breathe out. Breathe in. It really relaxes my hips, my knee, and also my lower part of the back. Do with your breathing. Breathe in, breathe out. Breathe in, breathe out. Chakki Chalanasana, or mill grinding pose. Put it here, put your hands together as if you're grinding a mill. Breathe in and slowly come down as far as you can come down and come back higher. Do with your breathing. Breathe in, breathe out. Breathe in, breathe out. Breathe in, slowly come down with your breathing and go higher. You can do from the opposite side. Breathe in to the opposite side and come back higher. Yeah. Do not try not to bend your elbows. Keep your elbows straight. That is the most important thing. Even if you cannot go all the way down, as I said, you go down according to your breathing and your capabilities. It's called Chakki Chalanasana. It's very good for your back. One is very good for your back also is a seated forward bend. What you do in a seated forward bend, take your hands on both sides and drop it in front wherever it goes. If it touches your toe, it's great. If it goes all the way down, better. Look straight high up, close your eyes and keep breathing. Count of 3 in, count of 6 out, and let the body come down on its own. It is the relaxation of the muscles which is going to take you down instead of you trying to get your head down. So your awareness is no pain and effortless breathing. Count of 3 in, count of 6 out. If you can come all the way down or wherever you can come, stay there for 5 to 10 breaths. Paschim Uttanasana, seated forward bend. Very good for relaxation of your back muscles. And you slowly get back. Yeah. So the sound I want you to hear is that you heard how you are breathing even in the pose. People ask me, when do I know I'm getting healthier, better? When you are able to breathe effortlessly in most difficult poses. You're doing a headstand, you'll get a completely effortless breathing, you are getting better and better. Baddha Konasana, put your feet together, the Titli Asana. This is to relax your hip joints. You bring all the weight together, put your hands, drop your knees down slowly, and just gently you try to relax your hip joints. Hip joint relaxation is a must to control your emotions. Yoga believes hip joint is site of all the emotions. So the emotion-related disorders, primarily emotion-related disorder today is hypertension. Your blood pressure goes up because I went to my boss's office. Or white coat hypertension. You have seen the doctor's white coat, the blood pressure goes up. Maybe I see your blue coat, my blood pressure will come down. And all neuropsychiatric disorders are very important for your hip joint relaxation. Once you do that, we recommend you to have a 12 asanas for a person who is doing your, we call it a NIROGI. Now you have transformed yourself, so we are progressing. We'll be doing a lot more difficult poses, and you will see, but this is the way you start. We're introducing you that if you can do it this, then you progress. The first asana, this is out of these 12 asanas, which you can see it here, and this is all in your list, is The list called Mandukasana, Shashankasana, Gomukasana, Vakrasana, Makradasana, Bhujangasana, Salavasana. This is the list, and we will go with this, and we'd like you to do this list and when you're practicing. A daily practice should be an hour. First hour should be your 25 minutes of asanas, 25 minutes of pranayamas, and 10 minutes of meditation. The first asana will be your Mandukasana. So you sit down on a Vajrasana. See if you can able to sit down on your hip. This is a very important asana. When you're able to sit down on your heel, it keeps your spine straight, and in Ayurvedic concept, it ignites our Jathar Agni. It's called the fire inside us. It's called the digestive fire. You'll be able to sit down comfortably and able to stay here with a completely effortless breath. This is called Vajrasana. And Dr. Chakraborty will tell you this afternoon, this supports your spine, supports your skull, and when the body knows your skull and your spine is all supported, body gets better. You do your yogic fist. Put your yogic fist at the level of your belly button. Take a deep breath in, look straight high up, and slowly try to bend your body down. And what you do, your attention is no pain and an effortless breath. You'll be breathing when you are there, completely effortlessly. As far as you can come down, and stay here and keep breathing. Try to stay here between 5 to 10 breaths. This is the first asana, it's called Mandukasana. This is very good for people with diabetes, people who want to reduce the body weight, primarily the truncal obesity, or we call the expanding waistline. This is a absolutely daily practice. People with diabetes, we want them to do little longer, more number of these asanas. Then you slowly get high up. Then you do a next one is called your Shashankasana, rabbit or moon. You take your hands, go all the way high up, put your hands all the way down as far as it goes, then put your hand down and stay here as long as you can. This is a very nice, comfortable, relaxing asana, and you will notice that in our yoga therapy practice, we really don't do much savasana. We don't do any counter poses, because every pose, what we do is a savasana. You need to be completely relaxed to get into these poses. You don't have to go all the way down. Remember one thing, okay, slowly you get up and sit down on a Vajrasana. Most important concept of yoga therapy is not to be in alignment and not to get mastered in the poses. What you want to use the poses in stages and in sequence for your healing. So you are going to look inside yourself and you are going to do as much as you can do with your breath. If you violate your breath, you are not going to progress anymore. Third one is Gomukhasana, cow face. You sit down, you're able to put one knee in the top of the other knee. This has all different names, a part of Gomukhasana, this is also called a Vaisasana, a lot of other names, but this is so relaxing. Initially he said, oh my God, how can I sit down like this? But essentially what will happen to you when you are comfortable, you're so relaxed, you'll sit down in sofa, sit down in bed, you'll be sitting lying down like this. So the knee on the top, my one for the right knee, my right hand goes high up, my left hand comes to the back, I drop it down, I touch it, I hook it, I essentially handshake each other. Again, it will come to you. Do not force yourself. As I said, initially you're holding the neighbor's hand, it's okay, but it will come to you. It came to all of us, so it will come to all of you. We are like a stick, and see what happened to our body. It will happen to you. Able to breathe, able to talk. You can dip a little bit more, take a deep breath in, slowly bend your head down. You can touch your nose to the knee. And then you slowly get higher. Balance it to the opposite side now. Now we're doing the other side, same way. Sitting down comfortably a little bit. Once you feel the level of comfort, relaxation, left knee, left hand goes high up, right hand is here, drops down, we touch it, we hook it, we essentially always try to do this with your eyes closed and with your attention to your breath. I'm talking, I'm breathing, but people who are trying to do it first, they'll be holding their breath. Be holding their breath, don't be able to do it. Again, dipping it down, just see if you can bend your nose down and touch your nose to the... See that how you're progressing? We started with the hands, we started with the smaller joints. Now we are getting into the relaxation of the lower part of the body and upper part of the body. Next asana is a Vakrasana. Vakrasana is a spinal twist. This is a very powerful asana. You put your foot in the front first. This is the asana which is powerful for your low back pain. Especially, there is a muscle called a piriformis muscle. We have a pain specialist here, and he knows what I'm talking about. The sciatic nerve sits on a piriformis muscle. It relaxes the piriformis muscle. You take your right foot, put your next to your left thigh. My right knee is high up, my right hand goes to the back. My left elbow comes outside my right knee. Left elbow can be straight high up, or it can drop down, touch my knee in the next time. Take a deep breath in, turn your body to the other side, and able to stay. Able to stay, able to breathe. This is called piriformis relaxer. Piriformis is the muscle on which the sciatic nerve sitting down. When you get a back pain, as if like a knife is sitting on your back, that is the piriformis muscle spasm. So you are doing this thing and so completely relaxed, completely effortlessly, with the effortless breath. So you really don't mind staying here as long as you can until your breath tells you that I have an effort. So relax slowly. In fact, we'll tell you to practice the asanas, and eventually you'll come and say, I'm practicing less asanas now. What happened? You feel the effect of it so much that you stay in the pose a little longer. You put it down. Other foot goes high up. Left knee. Go down here. My right elbow goes outside. Hand can still be high up. And slowly I can drop it down. Take a deep breath in. Turn my body away from it. It's Vakrasana. Spinal twist. It's a powerful tool for low back pain. Able to stay in a pose, able to breathe, that tells you you are becoming healthier and healthier. In fact, when you start doing it first, if you come to this pose, you won't be able to breathe. You know, you'll see that you breathe, you're catching your breath when you come to this pose. Slowly come back high up, put your feet in the front. From here, we'll go down now, your face down. We'll do the Markanasana. Let's go. For crocodile, put your head down. You can do so, I can take a look at it. Put your head down first and put your hand on your head, on your folded hand like this. First you breathe in, put your feet, both the feet down, breathe in, breathe out, bend your knees if you can touch your ankle to your hips as much as you can come down. Drop it down again, do it with breathing. Drop your feet down, breathe in, breathe out. Called the Markanasana. It's very good for your chronic low back pain. Chronic low back pain, treatment of chronic low back pain is extension of your back. So drop your head down, put your head down onto the mat, put your hands on both sides, palm facing high up, turn your face on one side, see how you feel. Then turn your face on the other side. The side which you feel a little bit more of a discomfort, you stay there a little longer. Yoga is a balance. You like to put your face when you feel a little discomfort and you can correct it. Next one is Bhujangasana. You put first to the Bhujangasana, what you do, you put your one hand in the top of the other hand and try to get up wherever you feel comfortable, able to stay. It's not the going high up that I cannot. Come up to the point where you can able to stay. If you go further down, you'll see your body is shaking. That is called your fasciculation. Sthiti. Once you find that, you come down, then you put your hands on the side, get up into the cobra pose, and able to stay in the cobra pose. That is the most important thing. In a yoga therapy, it's not that you get into the pose, get down and get into the savasana. You get into the cobra pose and stay there. It's beautiful, beautiful cobra poses. Very nice. Okay. Slowly come down. The third one, staying here, is your locust, Salavasana. Put your feet together and let both the feet come up slowly. And then able to stay in the pose. It's not the how high you can get up, it's that how effortlessly you can put both the feet high up with your effortless breath. When the breath has an effort, drop it down. Okay. Next asanas I have not put in the list, but it is a very good asana, and if you can do it, very good. It's called the Dhanurasana or a bow pose. You bend your knees, hold on to both the ankles, body goes high up like a bow pose. And then you're able to stay in the bow pose as long as you can with your breath. Count of 3 in, count of 6 out. Again, same breathing. then slowly come down. I gave you the list of these 12 asanas for you to practice daily when you overcome your disease a little bit, when you're able to relax. Put your hand again on both sides, palm facing high up. Just relax a little bit before you turn on your back. And slowly turn on your back, and the first asana you do on laying down, put your head towards me and feet away from me. That's the best way. You won't be able to see anything what we are doing, because you need to basically visualize your subtle body. Close your eyes and you need to see what you are doing with your body. In a Markadasana, you call it a spinal twist, or you call it a, with all different names we give it to it. It's called a monkey pose, Markadasana. We call it a Merudanda Sanchalanasana, spine moving, Jathar Parivartanasana. Bend your knees and keep your both the feet together. Put your hands on both the sides like a T. On both the sides like a T. Look on your right hand and drop both the knees down to the left side, opposite side. Look in the right side beautifully and put your knees down on the other side. Then able to stay in the pose. That is the most important thing. Able to stay in the pose. And breathe. Breathing is again same concept of breathing. Breathing in, count of 3 in. Slowly come back high up. And now to the opposite side. Look in your left hand, drop your both the knees to the right side and stay there. Slowly come back now. Keep your knees bent. Next one will be your Pavan Muktasana, or a knee chest. Hold on to both the knees. Bring it up towards your chest. Raise your head up. See if you can touch your nose to the knee. Or if you can, the chin goes in front of your knee and able to stay here. When you're able to stay here, you roll side to side to see how flexibility is your back. Roll side to side as much as you can. Then also you can roll front and back. Front and back, it goes high up, very nice. Drop your body down, keep your legs straight, hands on both sides, palm facing high up, and now pay attention to your breath. Take some deep breath again. Exhalation longer than inhalation. Count of 3 in, count of 6 out. So this was number 9 asana for your daily 12 asanas. Slowly move your feet. Next one will be a feet raising. Just raise one of your feet high up, 90-degree high up. Next thing, if you really want to do a little bit more, you can hold onto your toe if you can, and see if you can straighten up your leg if possible. This is a very powerful tool. One foot goes high up. You can hold on to your toes. Okay. Drop your hand. Let's drop this foot down. Let's get the other foot high up. It's called Utthita Padasana, feet raising pose. And then again, if you can hold the toes and straighten up your knee. Slowly drop it down. Now if you want to test a little bit your core muscles, just raise both the feet high up, just a 30-degree, not all the way high up, just a little bit high up, and you will see the difference it makes. Difference it will make, it really acts on your core muscles now. Okay, drop your feet down. Next one is a feet rotation. It's very good asana. You will raise your right foot high up and rotate 5 times clockwise, not the foot, whole at the hip joint, like a big circle. Make a big circle slowly with your breath. You'll do 5 times clockwise and 5 times anti-clockwise. And if you finish do that, then you will do that with the other foot, left foot same, 5 times clockwise, 5 times anti-clockwise. If you really want to do a little bit more, you can get both the feet high up, so if you can rotate both the feet at the same time, 5 times clockwise and 5 times counterclockwise. Last asana, which is called actually cycling, Sanskrit name is called Dichakrika asana. You get your both the feet high up and you start like riding a bike, slowly, one forward, few times, then you get backwards. What you find it out, people who rides a bike, they do not get any knee problem. Their knee pain, all the dysfunction goes away when you're able to do cycling. So laying down, you do a little bit of a cycling. This is a very good pose for improving your knee health. What you need to do about only 5 to 10 asanas daily, and you change the asanas in your daily practice so you can continue a whole practice, in daily practice. So, lastly, do a little bit of a savasana now. Put your hands on both sides, palm facing high up, and just pay attention to your breath and be quiet a few moments to give your body a relaxation response. Whole yoga therapy is totally based on relaxation response. You learn how to relax your physical body. You learn how to relax your toes. You learn how to relax your feet, your leg, your thigh. Once the part of the body is relaxed, it feels like that part doesn't even belong to you. You keep on relaxing your hip areas, your chest, head and neck. Most important area to relax is your neck muscles, trapezius muscles, sternocleidomastoid muscle. Relax your tongue, relax your jaws, relax your forehead muscles. This brings a profound relaxation to your whole body and mind. When the body is relaxed, you feel like you are transcending from your gross body to subtle body, called Sthula Sharir to Shukha Sharir. Yoga gave us three bodies: gross body, subtle body, and a causal body. You learn how to control your senses. Our body is an energy which responds to five senses. All the information we get from the five senses are stored inside our body, which is called mind. Mind is the contents of our five senses. Once you can control the five senses, which you'll hear this afternoon, Pratyahara, you will see your prana, the life force, it gets driven inside your body. You be aware of more about the prana, and prana does all the healing for your body. You learn how to focus, sixth limb called hara. The difference in a focus is a more concentration. It is a more thought process. You are thinking more and more to concentrate. But it comes to the point when the concentration diffuses, your number of thought process starts to come down. You enter into the state of meditation. Meditation is a state when your thought process comes down. We have multiple thoughts. We generate 25 to 40 thoughts a minute, thousands and thousands of thoughts in a day. Between the thought process, there is a gap. We enter into the gap during meditation. We increase the gap slowly. Even if you are not thoughtless, your thought gets into file and a folder, and the fluctuation of your mind comes down. Yoga is the chitta vritti nirodha, controlling the chattering of your mind. That is the state of meditation. Metaphor is your mind was like a fall, like a Niagara fall. Slowly it became like a river. From the river it became like a pond. Now it came to the point that it is completely no ripple. You can see through the pond up to the bottom of the swimming pool. That's your state of your mind. Last state is your samadhi. It's the union of your body, mind and spirit in the samadhi state. You are also balanced. Body, mind and spirit is balanced. Health is defined as a balance of your body, mind and spirit. And you practice the seventh limb, all the seven limbs to achieve the eighth limb. Slowly move your toes, move your hands. Do the same again, yogic technique. Take both the hands in your hand, rub it both the hands together again. Rub it hard as possible. When you feel the heat of the hand, again put it over your eyes, cup it over your eyes. Massage your forehead, massage your face, massage your head and neck. And slowly turn on your one side, bend your knees, put your head into the folded hand, and you get up and you sit down. For our next now, we will be progressing to a yogi and yogini. Now you'll see what the yogis do. In India, the yogis does it daily. They used to go to like a gym. They call it a akhara. And the gym, they used to prepare their body. They did not have all the weights or all the treadmills and all this stuff, but they were, powerful. Each one, yoga is very powerful. I will show you what brings that power in their body. After you have done this, when you have got a little bit of comfortable, we introduce two more pranayamas, which we'll also do this afternoon. These pranayamas, the one is called your Nadi Shuddhi pranayama. In Nadi Shuddhi pranayama, we'll do alternate nostril breathing. Most of you have been doing it with us in the class, but you will see a little bit more. We'll include called kumbhaka, the breath holding. Will be 1:4:2. We'll be practicing this afternoon, and also we'll be including called Ujjayi breathing, called resistive inhalation. We'd like you not to do the kumbhakas, the breath holding, or resistive inhalation when you started doing the pranayama practice. Because it happens, you will see that initially you will be able to do only maybe 30 seconds or maybe a minute. And before we progress, I just want to show you one thing. This is the meditation we'll be doing. We have this person sitting here now. I just want to give you a little bit of story about her. I've been showing her to a lot of the medical seminars here. Patricia is here. She's 59. In 2005, she developed a lower leg weakness. She was diagnosed with multiple sclerosis by MRI. Came to the yoga therapy class, not in a wheelchair. This is maybe wrong, but she was weakness. But she came with very weak legs. But what interesting was for her that in 1 month she stopped taking medication for asthma, which she had almost plus 20 years. That is the healing power of breath. That's what saying all the asanas you do, you prepare your body for able to breathe. The breathing is the one which will do all the healing. And with yoga classes, the leg weakness has gone down. It improved her balance in 4 months. And she had a medication which is called the biological medication. Many of our multiple sclerosis medication staff. She's so excited, she went back and put her license plate. You know what license plate says? For transforming. So she said, the transformed is already being taken. Somebody's already transformed. So I'm transforming. She put the transforming. She's here. Give a big applause to her. She has done a miracle for. In fact, when we teach our physicians, we'll be teaching. We'll be doing it February 15. I connect them to her, so they ask her questions. and he put them on a speakerphone and listened to her all the time. This is on Alan. He's supposed to be here. He's not here. He has another history which almost medically, not curable. He's 73 years old. He had an ischemic cardiomyopathy with ejection fraction of 10 to 20%, and a multiple admission with acute congestive heart failure. Basically what it is heart basically is dilated. We also call it dilated cardiomyopathy. Heart doesn't function, and they're literally non-functional. They cannot even, he cannot even breathe normally. Walk a little bit and get short of breath. It is severe coronary artery disease, and is seen by the two surgeons, and he was inoperable. They refused his surgery because he said the 10% ejection fraction. With the yoga practice in 6 months, the ejection fraction is rechecked again of 40%. And the reason is, it's called relaxation response. When the periphery relaxes, it is called afterload. It's a cardiovascular component. Afterload goes down, heart able to function better. And the breathing, more fluid comes in, it is called a preload. The preload gets better, afterload comes down, his ejection fraction goes up to 40%. So, what do you do here? As a yogi and yogini, what a yogi will do, you'll generally go to an hour of 30 minutes of practice. As I said, 25 minutes of asanas, 25 pranayamas, and able to sit down in a sukhasana, siddhasana, padmasana, which you did, 33 pranayama. A lot of people ask me about mantras. Every time I go there, they ask me about mantras. Mantras, remember one thing, mantras are a vibration. Mantras are more of a vibration, less of a word. So mantras, the vibration quiets down your mind. It's the same vibration as the head. So these are the mantras which yogis practices. I'm not going to go over these mantras. If you really want to know these mantras, in fact, I think I have all these. You can go ahead and ask my guru. My guru is, I'll tell you all the time, my guru is called Google. You can Google it, you'll get all the mantras in Sanskrit, in English, and all the translation. The mantras which goes through, this is the asana, sukhasana, siddhasana. This is ardha padmasana, the padmasana, which you look to slow down. That the first was called Gayatri Mantra. Gayatri Mantra, the name I want to give it to you, so that these are the wordings here. Okay, something has happened. The Gayatri Mantra. Okay, so the I don't see it here and okay here. Okay, let's You have all these asanas there, all the mantras are there, we'll tell you, but I'm going to skip some of these asanas. What we'll do, we'll show you what you need to do to be a little bit more active and a little bit more yogic practice. The first yogic practice is that to relax to relax your muscles. Very important. What yogis used to do, yogis used to sit down. This is called a malasana. So if you can sit down in the squatting pose, try from sitting down like this. This is not that easy. Initially you'll be like this. And then slowly and slowly you'll be able to sit down like this. And you can incorporate in your daily practice. From there, what you will do, you will be, if you want to practice it, you want to get up without a support. If you can get up without a support, this is your 24/7. This will give you your physical independence. That's what the yogis practice it. You sit down, in a squatting pose, and you get up with it. Once you get up, you want to practice, with the balancing your both sides of the brain. Balancing is, if you cross your feet, if you can sit down with crossing your feet down. Good job. Then if you get up with crossing your feet, get up. Then what you do to balance your other side of the brain, you cross your feet on the other side. Then sit down, crossing your feet on the other side. Then you get up, crossing your feet on the other side. Super brain yoga. Anybody has seen super brain yoga? Great. This is super brain yoga is a punishment for Indian school children. What they do, they put your feet separate, take a right hand, hold on to your left earlobe. Left hand, hold on to your right earlobe. Then you take a deep breath in, you sit down and get high up. Sit down, get high up. There is studies after studies done in MIT. It shows it balances both half of your brain. Even electrical activity of both half of your brain, it becomes equal with this super brain yoga. If you really want to know, check with my guru. Google, but get into MIT website. Problem with the Google is you'll get all the junk also in Google. The mountain pose, you'll be able to put your feet together. Think about your neck, shoulder, and your hips at the same level. Once you do that, in a mountain pose, you put your hands on the top now, practicing a balancing poses. Breathe in, breathe out, slowly your hand goes high up. Upward mountain pose. Comes down again. Breathe in, breathe out. One more time, breathe in, breathe out. Keep your hands up, feet down, oblique mountain pose. Breathe in, slowly come down on one side. And same breathing, come back. Breathe in, go to the opposite side. The same breath comes into the middle. Slowly come down. One very good pose is your Trikonasana. Separate your feet, turn your right foot out, hands on both sides, touch your right knee, look into this hand, and slowly let your body come down. You close your eyes and breathe. Count of 3 in, count of 6 out. Slowly and slowly your whole body will come down. When it comes all the way down, close your eyes, continue breathing. Count of 3 in, count of 6 out. We'll tell you the anatomy of these asanas after lunch. Dr. Chakraborty will tell you all about asanas, and you have it in your hand. Slowly come back high up. Turn your right foot in, left foot out. The hands again, same way. Look in your hands high up. Slow, come back up again. You can put your feet together. A very powerful grounding and balancing pose is just all the warrior poses. You don't have to do completely aligned. You know, when I do it, people get so many, oh, you're not proper. So what you need to do, put your feet to the back and bend your knee and ground yourself. You will see when you're going down, the sthiti, the stability. You can feel, you know, your body starts shaking. Back up. Put your hands high up here. This is your warrior one. Virabhadrasana 1. Then you can put your hands on both sides. Turn your body in the same plane. Virabhadrasana 2. They can turn your body again the same way. One foot goes high up, drops your body down. Virabhadrasana 3. Warrior 3. Drop it down, come back high up, the ball balancing and grounding. So bring your feet high up, and the other foot in the back. Same way, drop your knees, be sure the knees at the top of your ankle, don't go all the way down, and you'll feel the grounding, you know, you'll feel that little shaking grounding, but go back off. Hands go high up, Virabhadrasana 1. Hands on the side, goes all the way to the side, 2. Then goes in the front, other foot goes high up, and stay. Come back, hands to the front again, drop it down, come back in the front of this. And we'll do first, now you do a yoga now, okay? First we'll do a sun salutation. Surya Namaskar. Surya Namaskar has a 12 steps. You're doing, there's a mantra with each one, but you will be doing the breathing. Breathing is very important. Put your hands in front, and you can look at both of them and look at the picture. First the pranayama, hands in front. Breathe out. Then next one is hands all the way high up. Hastottanasana. Breathe in. Third one, hand goes all the way down. Hand touches your, and head touches your knee. Padahastasana. Number 4, right foot goes to the back. Hand is on the both side. Head goes high up, Asa Sanchalanasana. Number 5, left foot goes to the back. Look at your belly button, Parvatasana. Number 6, your knee is on the mat, chest is on the mat, so body is in the mat. Ashtanga Namaskar. Number 7, Bhujangasana. Number 8, go back to the mountain pose of Parvatasana. Look at your belly button and try to ground your feet with the heel down on the ground. Number 9, right foot goes in front, in between your hands. Chest opens up, look high up, Asa Sanchalanasana. Number 10, Padahastasana, left foot comes in the front, hand on both the sides, head touching the feet, neck, knee. Number 11, Hastottanasana, hand goes all the way high up. And number 12, Pranayama, hand comes in front, it became. So, sun salutation is to prepare your body, all the yogis used to do. So, as a rogi or disease, you really don't do at the beginning. You prepare yourself when you're ready, sun salutation. General sun salutation done in a pair. You do it 2, 4, 6, 8, 108, 1008, 108. Who wants to do 108 sun salutation? Anybody? Nobody? June 21st, summer solstice. We'll tell you where to come. 108 sun salutation. Sun salutation is being balanced with your moon salutation. In a moon salutation, you take out all the hitting poses. We'll do one the same way. You put your hands in front. Now with the breathing, breathe in. Breathe out, hand goes all the way to the back. And breathe in, hand comes down. You literally sit down on your. You take out all the hitting poses. Then you breathe out, right foot goes to the back, knee goes in the ground. Breathe in, hand goes way high up. Breathe out, hand comes in the front, and left goes to the back, knee on the ground. Hand goes all the way high up. Breathe in. Then you come all the way down, head touch using your mat. Breathe in, you get up into a cobra pose. And breathe out, you go back to your child's pose or Shashankasana. Breathe in, both the hand goes high up. And breathe out, left foot comes in the front. And hand is on both sides. Then breathe out. Then hand goes high up. Right foot comes in the front. Hands on both sides, head touching your knee. Hand goes all the way high up. Hand comes in the front. So you do the sun salutation and the moon salutation. You will be doing your body balance. Once you do that, you do the yogic jogging. Yogic jogging is a jogging designed by Swami Ramdev. You have the pictures in your back. The first three will be doing slowly is called your jogging. The 3 jogging called spot jogging. Then the 3 squats, 4 spinal flexibility, and 2 aerobic star jump and a side jump. So the first one will be you just keep on spot. You just keep on moving like this little. So the 1. Second one, your hand goes high up, and then slowly your feet, look at the feet, touches your hips. Now you're doing yoga now, okay? You're ready for your lunch, you know? Okay, so you do this, then you do, this goes high up. 1, third one. You can do a little bit of, this is part of your spot jogging. 3 numbers jogging, then you do the squatting. Squatting, first you do an Ardha Baitak. You do a half squat, with the breathing. Breathe in, breathe out. Then you go all the way down. Then you do a Hanuman Baitak. Separate your feet a little bit. Your hands in front. Go down one side. Go all the way down. All the way down on one side and get higher. Then you put your one side, turn your feet one side, go all the way down. So number 6 here on a sun salutation. Number 7, keep your feet separated, hands in front, breathe in, breathe out, take it all the way to the Breathe in, breathe out. Breathe in, breathe out. Then you can do on your side, and if you have to do on the side bend, you put your feet, or you can do this way also. You'll be doing one side like this, like that. Breathe in, but the other side like this. Then comes the cross, forward cross. You breathe in, 1 and 2. In the front, you can put your feet together, your hands there, all the way down, touching your toes. Breathe in, breathe out. Number 10. Number 11. 1, 2, 3, 4. Then you go continuously as fast as you can. This is the competition, yogi competition now, yogi boot camp. Huh? See how long you can do? Talking, breathing. Huh? How many gave up already? No. Okay, no more torture, huh? Side jump is very interesting. You go on one side, go the other side. And keep on doing it on both sides. Now you know why yogis are so strong, huh? It's not the end of it yet. Talking about yogic push-ups and yogic sit-ups. I'll show you a few, not all of them. Let's do one thing since you're standing up. Yogic. No, let's do the yogic squat first, Let's do the squats and standing up. In yogic squat, first is your Ardha Baitak. In an Ardha Baitak, what you do, you just do a half squat, get up, what we have done. Then it's called a Purna Baitak, full squat. All the way down, all the way high up. All the way down, all the way high up. There's a Ramurti Baitak. What you do, you put your hands in front, close your fist, and take a deep breath in, and slowly get down on your own. And get high up again. Ramurti was a powerful yogi, and he has designed this, all the Ramurti. Then you come to Palwani Baitak. Palwani Baitak, Palwan means you're a wrestler. What the wrestlers used to do. In a Palwani Baitak, you do, first, you put your hands, you sit down, get high up. And sit down, get high up. Take a deep breath in, go down, get high up. See, yogis progress. Then what they do, they progress, they do 3 times. They go down, 1, 2, 3, get high up. 1, 2, 3, get high up. You sit down, 1, 2, 3, up. 1, 2, 3, up. Last one. You jump in front, sit up, go back. Front, sit up. Okay, get into the mat. These are push-ups, called yogic push-ups. You talk about your weight training, talk about your treadmill. This is what, if you do it, if you put your heart rate monitor, you will see what happens. We'll do a few of them, and you'll see how easy it is. Sadharandan is a push-ups. You'll put your hands, if you want to do it with me, you can. If you don't want to, you can watch it, and you can breathe. In Sadharandan, you go down, come back higher. Simple push-ups, simple push-ups. Come back. Got it? Ramurti done. Ramurti is go down, and same way you come back high up. Go down, come back high up. Coming back is the most difficult one. Go down, come back high up. Hanumandan. Put your 1 foot high up, you push down, come back. Put your 1 foot high up here, push down, come back. Yeah, a few takers. That's good. Chest opening that. Dokka Vikasa. Look at my hand. My hand goes like this. My hand goes like this. Breathe in, body goes down, goes high up. Breathe in, goes down, goes high up. Bakha Vikas done. Bakha is a chest opening done. Alright. Yogi boot camp, you know? Not done yet, huh? Brishchik done. You put your feet high up, go down, come back high up. 1 foot high up, go down, come back high up. All right. Look at our gold medalist.
Oh my gosh.
Mine is really good.
Okay. Mishradhan, Mishra is a mix. Mixradhan, that you can practice. That's what yogi said, how yogis get the strength. Hands in front, you sit down if you want to. Sit down, you want to go jump back, push up, come in front. Go back, to push up, come in front. Mixed. Mishradhan. Go back. We started from nowhere, look where we are. Huh? This is what yogis do. There's a lot of other dhans, but it's called chakra dhan. Sarpa dhan. You turn your feet. It's a lot of things. You're all in the list. And if you want to, Google it. You'll find it. All the pictures are there too. I've given you some pictures. These are the pictures Dr. Chakraborty prepared a long time back for your reference. This is the pictures I got from one of the best institute in India called Morarji Desai National Institute. I gave it to you. These are all the asanas for your reference. These are the practices which you do as a standing up poses. These are the poses you want to do it, and the one you really want to do standing up is a balancing poses. Most important balancing poses, and also spinal flexibility poses. These are the spinal for Dandayama, Yoga Mudra, and Prasarito Padottanasana. I'm going to look at all these. These are again sitting poses which we have already done. And these are lying down poses which we have done. And these are also this lying down poses which we have also done. Now, what you really need to know is that the first thing in the morning, when you are really, before you do that, what you really need to do, you need to relax your muscles of the back. Best way to relax your muscles of the back is to be against a wall. If you go against a wall, if you put your body against the wall, it will give you a sense of relaxation. Then you will do a little bit of your supported forward bend. You don't have to do, just take a look how I do it, and you practice it daily first thing in the morning. You will be feeling an entirely different person. Then when you do all this stuff, push-ups and sit-ups and sun salutation, you know, you'll be like a breeze. What you will do, you will go against a wall, like if this is a wall, you will put your body against the wall straight, and slowly, initially your body will be like this, but when you do it, your hand will go all the way high up, like this. Then you keep your eyes closed, keep on breathing. When you feel that effect of relaxation, what you will do, you will support your spine to the back. Best way to support is, put your hand and push it all the way to the back. This is the way your spine gets supported. When your spine gets supported, what you do, you let your body drop by its own. You do not do anything. What you do, you just keep your spine straight and let it drop down. Slowly the relaxation will push you all the way down, and continue it all the way as far as it comes down. And this is the way what happens. A forward bend, unsupported, you can have some difficulties. With this, your head will slowly come down, touch your knee, and your body will all come back higher. It's called Dandayama Yoga Mudra. It's a very good tool to prepare your back and prepare your spine. Now, people who can do, I've seen a few people are doing very well, will be doing a few more difficult poses, and we like you to do, and most of the difficult poses are laying down poses. Now, let's lay down into the mat. This time, you lay down with your head and look into me. So, because you need to see what we are doing. First asanas you will do to improving your core muscles. We call it improving your Jathar Agni. For the Jathar Agni, you lay down. First, you will do a yogic sit-ups. You put your hands all the way to the back, and you will get up with the hands in front without a support. Yogic sit-ups. Beautiful. Keep on going down one more time, and get high up. Now you'll do yogic sit-ups. You put your hands behind the head, and try to get up. And you say, oh my God, what happens to me, huh? See the difference, what happens? Now you're thinking, beautiful. I'm impressed, look at you. It is all about core muscles. Okay. Next one is a difficult pose called Padmastikasana. You'll hold on to your right foot, bring it up, touch it to your forehead. Left foot is down, all the way down. Hold on to your right foot. Comes up. Yeah, it's coming. Christmas is coming. New Year's is coming. Okay, let it go. Hold it to the other foot. Goes high up. Touches your head. Okay. Next is hold on to both the feet. Bring it up. Touch it to your forehead. Then put it behind the head. Look at her. There she is. Called your, Garbhasana, Sirapadasana. Look at that. Take a picture of her, you know. Yeah, you did. Look. If anybody wants to see, that's what you need to do it. Next pose. And yogis go to sleep like this. Look at her. She's sleeping now. Huh? The feet behind the head, and they're sleeping. And the reason is basically physiology behind it. You put your head, put your feet behind your head in a profound sense of relaxation. Next three poses, which is always yogis do, is your shoulder stand, plow, and a cartwheel in sequence. When you get a shoulder stand all the way high up, touch, when you get a shoulder stand, you are able to touch your chin to the chest. If you go way high up, touch your chin to the chest in a shoulder stand. And you're able to stand a shoulder stand. People who are doing it well, you can do one thing. You can wrap your feet like an eagle pose. Garurasana on the shoulder stand. Very nice. You can even do a lotus on a shoulder stand. Padmasana on a shoulder stand. Get your feet together. Oh, okay. Then you can go, it's coming. Very nice. Then you can go put your feet all the way down in the plow and stay in the plow. Plow is your sleeping pose. You sleep in plow. You don't believe me? That's true.
I can sleep.
Yeah, you can sleep. Look at her. She's sleeping in her plow pose, you know. That's what you need to. Because remember one thing, it is a power, you're relaxing all the large muscles. You are in a sense of relaxation. That's what it gets you to. Okay. Slowly come back now. Then it's a cartwheel, chakrasana. Put your hands on the back and so you can get up into chakrasana. Yeah, look at this. Put your hands on the back. Yeah, get up. Yeah, you need to walk now. Look at her. Look at her, all the chakrasana. This is called anti-chiropractor asana, huh? All the chiropractors will run away from town when you can do it. Beautiful. Look at all of you. Is it Shirley? You can time to walk now. The spider woman. Inversion poses, cartwheels are a must for a yoga practice. Yeah, here she is. Look at her. Yeah, look at, that's what you need. Beautiful. Wow. Okay. All this thing happens not before you're trying. You know why it happens? It came to you because you learned how to relax your small joints and everything. So at the end, what you do as a powerful relaxer is that you do a headstand. You do not do a headstand. If you want to do a headstand, you will never be able to do a headstand. If you want to learn how to do a headstand, you will be learning it in a few hours, few weeks, few months, few years, never. How to do a headstand. When you put your head down, you feel miserable. Why? Pressure inside the head goes high up, pressure inside the eyes goes up, you cannot breathe, you cannot talk, you will flush. Don't do anything. Keep your head down. Keep your head down, keep your head down, and try not to do headstand. What will happen? Baroreceptors. Inside our body, there's a mechanism called baroreceptors. Baroreceptor sensation comes in. Baroreceptor lowers our pressure inside the head, lowers the pressure inside our neck. And you will see all of them that by the time a person's pressure comes down, here he's measuring pressure inside the blood vessel here, the pressure is entirely normal. What he does, he will go and measure the pressure inside the leg, the pressure inside the ear, pressure inside the head is same. When the body stabilizes the pressure, body will let you for the body to go high up instead of you trying. So contrary to the belief, headstand does not increase your blood flow to the head. Now, I know many of you can do it, but before you do it, let's see what are the steps you go through and if you really want to learn. Because if you're able to do a headstand on your own, what will happen to you? You develop called baroreceptors sensitivity, increased baroreceptor sensitivity. So if you have hypertension, blood pressure will start to come down. If you get a heart disease, blockage in the arteries will open up. It's relaxation response. And primarily what will happen to you in your mind, which is a powerful response only neuroscience can interpret. I have a memory. What is my memory? I look at you, your picture is permanently imprinted on my brain. If you do a brain scan on me, you will see a part of my brain is active because I'm looking at her. If she's in my memory, I close my eyes, I think about her, same area of brain will get active. It's a powerful tool which we learn through functional MRI. That is called what our subtle body is. So now what is going to happen? What is going to happen, I know the whole world, in normal orientation. Now in my headstand, my whole world is upside down. My brain has no idea what is this. My brain literally wakes up. What is this image I'm just looking at? I've never seen this image. Your brain function is purely an exercise for your brain. Most of the people, intuitive people will tell, my intuitive power, all the action comes in headstand. So, in a headstand, what you do, first you will be doing, look at the steps. If you look at the steps, you will be able to do it in a quick process. It takes a year, it takes an hour, it takes months. You will put your head down. You will put your head down and you will feel miserable. You get your head down, you feel miserable, but what happens, you keep on breathing. When you keep on breathing, few things happen to you first. First, your balance will go away. When your balance goes away, the things will happen to you, you'll always fall in front. That is called proprioception. You never fall on the side. So look at what will happen to you. If you put your head down here, if you keep your foot down here, you go like this, you will never fall on the side. So if you go from here again, if you put your head down, if you keep on walking, you fall like this. So if you keep on falling like this few times, your body will get the orientation. And that's how I need to. Then you put your head down, what will happen to you? If you put your head down, and then get your feet high up, and you keep breathing and talking, and your feet goes high up. And goes high up, slowly and slowly you'll go high up, and it will stay all. The most important thing here is that, try not to get into the headstand. More you try to get into the headstand, you'll never be able to get in there. So, just for the heck of it, if you really want to, put your head down, see how miserable you feel, and you will see our headstand expert will put a head down. This is called unsupported headstand. You will see an unsupported headstand. Hand on the side, head goes high up. Look at that, my headstand. Okay, this is called unsupported. This is unsupported headstand. And she can stay here, hours and hours. Look at her. Beautiful. Okay, everybody's going high up. Here he is. Now, look at it. His pressure in the head, pressure in the leg is normal. This is same situation as called your vasovagal attack. You stand up for a long time, follow. Okay, and look at my man with a Parkinson's disease. Can you believe about that? I take a time for a picture. Who has the camera? Take a picture, please, with me here. Okay, come on, take a picture. Look at my other feet high up. All right. Look at this. I want to send it to New York Times, you know.
I need you over on this side.
You need me on this side. All right. I'm holding him. Yeah, you get it. You tell me when you feel miserable. You don't feel miserable. Got it? Okay. Come down now. Okay. Okay. Imagine this: a person with a Parkinson's disease. When he came to our class, he could not even walk. You know, he was shaking like this. He walks straight high up, and he walks like this, and he is on his own. Look at this. Is called art of transformation. This is transforming, not transforming. Not transforming. So, you know, these are the people who are really example, and we have really. So, who is giving a try? I looked at it, very nice. All right, you know. Feel miserable yet or not? No? Only way you'll be able to do it is that when you say, I don't want to do it. Huh? The moment is I want to do it, and then you get rid of your fear, F-E-A-R. Okay?
Can you do it, Dr. Sarkar? Maybe it hurts your neck.
It hurts your neck. If it hurts your neck, don't do it. But I tell you one thing. All the pain in the neck will go away. Because you know the pain is from the tightness. You know, pain is not from, you know, you have a herniated disc, nerve irritation, all causes irritation of the nerve, tightness of the muscle, tightness of the ligament. Tightness causes pain. The moment you're able to do a headstand, completely relax, your neck pain will run away. The moment you say, I have a neck pain, I don't want to do it, don't do it. You know why? The neck pain will get worse, you know. You get a more neck pain. Yes, sir.
Just after I do a headstand for the first 4 or 5 minutes, my shake goes away.
Hey, is there any video recording here? Come on, say what you said.
I said after doing a headstand for about 4 or 5 minutes, the shake in my hand goes away. It becomes stable.
How many doctors are here? So, now you know what he's talking about. His dopamine level goes up. Okay? The whole yoga practice, all the neurotransmitter level goes up. Your dopamine level goes up, GABA level goes up, your serotonin, and he feels great.
Yeah, it really feels great.
Actually, he's here, he sent me an email, he's here to teach other people with Parkinson's disease how to get better. He's going to have a yoga for Parkinson's class. How many Parkinson's? I think 3 now.
How many Parkinson's patients are here?
3, 4.
One did
Parkinson's here.
One did come.
One didn't come.
His architect's wife is a Parkinson. Bob is another Parkinson. Get a Parkinson. Here is a treatment. Okay? Connect with him. Anybody wants to give a try for a headstand?
Can I ask a question?
Sure.
What about TBIs, traumatic brain injuries?
Traumatic brain injuries, in fact, PTSD, traumatic brain injuries and all this stuff will teach you all pranayama. You first start, you do a kind of Bhastrika pranayama. We'll do it this afternoon. Do a very rapid sequence Bhastrika pranayama followed by Savasana. That is the primary treatment for traumatic brain injuries and PTSD. Following that, when they get transformed slowly, like for him, I mean, he was totally incapable of functioning. He was totally non-functional. So now he comes to the point, then they'll overcome. Remember one thing, our body is a hardware, mind is a software. Once you control the mind, it will overcome. We really do not even consider, I have a back pain, I have an artificial knee, I have an artificial hip. Those are just a hardware. To fix the hardware to the software. Okay, any questions?
Gentlemen, how long did it take him to get to the...
I saw changes almost within the first 2 or 3 weeks just doing the daily practice. I mean, it was that, and when within a month and a half of my first yoga session, I went to my doctor, and I did the high mountain balance pose, and she was just, whatever you're doing, keep doing it.
She goes to see her neurologist. Look at this. This is a patient with Parkinson's disease, and he's standing like this when before she came to the room, you know. But she said, keep on doing what you're doing, you know. So, okay, primarily the answer to the question, it is really a state of mind, and it really has nothing to do with his timing, my timing, and your timing. I have seen personally says, and I've been trying headstand for 5 years before I could do it. This lady says, I did it in 10 days. There's a man, you know, he's absolutely straight, you know. We have one who does a headstand. You know, there is a, what was it, you know, there is a stage about 15 feet high and all the way down. He's at the edge, you know, doing a headstand. If you drop, you drop all the way down. I said, Chris, what are you doing? He said, nothing happens. No. I know I'm not going to fall down. I'm going to hold back. So this is all the state of mind, you know. Yes?
I know a lot of people, it takes a while to learn, sometimes to learn this, but my question is there benefits in the stages up to that? Same benefits, or do you have to go all the way inverted to get those benefits?
No, benefit is a breath. If you keep your head down, and if you see your breath, you know, you stay there and able to breathe. If you're doing against your breathing or fighting your breath, it's not going to give you benefit. You know, it's called Annamaya Kosha to Pranamaya Kosha. The steps you are going to do it, you know, even this is good enough as an inversion. Breath is telling you that your body is in balance. Any imbalance is the yogic Ayurvedic principle called Annamaya Kosha to Pranamaya Kosha. Any imbalance in the physical body will show up in your breath. Any other questions? You'd like to do? Yes.
So this is what I'm saying. So with my traumatic brain injury and the PTSD, my doctors told me I can't put any pressure on my head. So therefore, when I teach yoga or when I teach to the warriors or when I practice, I don't do anything on my head. So can we do things on our head?
Okay. Beautiful question. The answer to that is very simple. My doctor asked me not to put my head down. So the answer to that, you have another doctor. And you go to see your doctor. The doctor is doctor within you. You have a doctor inside you. The doctor inside will tell you what you are doing, the stages. You put it, if you really want to do a headstand, you put your head down, you look for two things. Your breath and don't even, just put your head down, breath and your awareness to your pain. And keep it down. Don't push yourself. And let it come to you. You are not going to hurt you. I have an ophthalmologist. Ophthalmologist says I have a glaucoma. Yeah. I have high intracranial, intra pressure. What should I do? I said, aren't you ophthalmologist? Yes. I said, don't do it. Don't do a headstand. Why do you want to do a headstand when you have a glaucoma? He said, I don't know. I want to do it. I said, keep on doing it. Keep on doing it. Only thing you need to do, your breath. Remember one thing, any imbalance you do to your body will show up in your breath. Doesn't matter whether it's inside your eye, inside your brain, inside your lung, inside your kidney. The moment your breath is completely effortless, you can put your body in any kind of position without getting hurt. But the moment you put it down, you say, most of the power lifters, I teach them. That's what they do. They will take the weight, they'll say, take the weight. So don't do that. Take it, lower the weight, lower it down, take a deep breath in. Then what you do, chest push up. The moment you do with your breath, you progress. So this is the most important thing. We really have no concern with this hardware. You have a traumatic brain injury, you have people have to, you cannot imagine what happened to people. We get thousands and thousands of testimonials. People cannot even do everything, laying down. Rheumatoid arthritis, laying down to a pranayama. I just saw a lady, she just gave testimonial. She had a liver metastasis. 7 months she's overcome a liver metastasis of pranayama. It's an essential, powerful tool that the moment you follow the breath. What else? Before we break down, well, let's have some questions before we eat. Auditing, eating, we can talk. Yes?
When you're doing the squats, when I do my squat, I can't go all the way down. I stop, right here, before this, my heels are up. Is that okay?
That's okay. Only thing what you need to do is stay in the pose. The pose you're in, can you run a marathon today? No. Okay, but if you practice yourself, you'll be able to run a marathon. Okay? So where you are, we were there too. So how did you come up here? We had it in stages. Okay. So any place where you are, even if you cannot sit down, and if you cannot even sit down, stay there. In squatting, if you're squatting here, do your breathing. Slowly you will see. It will going to happen on its own, before you even try. But you follow your breath and pain. If you come down here, it hurts, back up. Do not get into the pain, do not get into it. Okay. One more here first.
Do you recommend using props? Like if you can't get your hands in cow face?
Definitely. We ask you to use the props, use the straps, everything, but in a decreasing orders. Do not rely on the props all the time. You started there, if you have a prop, try to get a prop, which most of the yoga studios don't use it. If you're 4 inches, get a 3 inches, 2 inches, 1 inch, and essentially you'll be progressing on your own. Like in the hand, especially for Gomukhasana, use a strap initially, but also slowly it'll come to you. This came to us, came to all of us, will come to all of you. You have a question here? Somebody raise your hands. Yes.
And just a question on the squat. So is it better to have the toes pointing forward and hip width apart and be higher in the squat, or the legs wider with the toes facing out and come lower into the squat?
Initially in the squat, you put your feet to, as close as possible in the shoulder. Then you can come down all the way. And when you get better and better, then you separate. More and more you better separate, more and more wider stance you get in your hips and that. But don't force. Let it come to you. It'll come to you. Anything else? We can continue this whole day, yoga is 24/7. It's not that, you use your breath and continue your breath. What is the time now? Anybody has the time?
It's 10 after 12.
10 after 12. Should we break now or continue?
And I tell people where food is.
Oh, where the food is.
If you do